One of the most devastating news for patients and family in the hospital is when they're told there is sudden shutdown of the kidney, which is much like a heart attack, and it can occur in hours, leading to inability to clear blood from toxins and excessive fluid buildup, which if left untreated can essentially lead to death. The incidence of acute renal failure in the hospital can vary depending on primary cause of the hospitalization, but in the intensive care units, it could be as high as 7 to 20%, and among multi-organ failure patients, the mortality can reach up to 70%. The causes of sudden shutdown of the kidney could be divided into three major categories. Pre-renal, first one, which is usually caused by low blood volume. It occurs in a patient who's had nausea, vomiting, diarrhea, bleeding, or low blood pressure if they were taking blood pressure medications such as diuretics, which essentially lead to low blood supply into the kidneys. Second category of acute renal failure causes are intrarenal. These causes are within the kidney. If there is a nephron toxins, such as antibiotic usage like aminoglycoside, chemotherapy medication like cisplatin, HIV medication use like tenofovir, or even synthetic cannabinoids such as spike. This is used commonly in the streets by kids. Surgeries also can cause low blood pressure, sepsis or infection in the blood. All of these can cause what's called acute tubular necrosis, which is sudden shutdown of the kidney. The third and less likely cause of acute renal failure is when there is urine flow that has been blocked by a tumor, stone, or simply enlarged prostate in male, where simply the obstruction is causing the urine toxins buildup in the patient. Now, the signs and symptoms of acute renal failure usually are low urine output, less than half a liter a day, or in extreme cases when toxins already have built up causing nausea, vomiting, uremic symptoms, or could be shortness of breath with leg swelling, abdominal wall swelling. But of particular interest, a life-threatening complications of kidney failure is potassium buildup. If left untreated, it can cause certain death. Most patients will need to see a nephrologist with these conditions and receive emergent medical treatment, and at times require dialysis therapy to sustain life. An important factor in kidney failure patients is that when blood is inundated by uremic toxins, other organs including brain, heart, liver cease to function properly, even though they are functionally intact. So treatment of kidney failure is paramount to the healing and patient recovery.
If your kidneys were to fail, your kidney specialist or nephrology may recommend you to start on dialysis, and this is a life-changing event. Hemodialysis is a treatment done by a machine when your own kidneys can no longer take care of your body's needs. Dialysis removes waste, salt, and extra water to prevent them from building up in the body. Keeps a safe level of certain chemicals in your blood, such as potassium, sodium, and bicarbonate, and helps to control your blood pressure. One of the methods of dialysis is in-center hemodialysis. This involves going 3 times per week to your hemodialysis clinic, usually on Tuesday, Thursday, and Saturday, or on Monday, Wednesday, and Friday. The time spent receiving dialysis treatment will depend on the needs of each patient. Most of the patients require 3.5 to 4 hours. Before each treatment, the patient is weighed to assess how much fluid the patient has gained since the last treatment, and to determine how much excess fluids need to be removed during the treatment session. Another function of the kidneys is red blood cell production and bone mineralization. During the hemodialysis treatment, the patient will receive medications to help with the red blood cell production and improve their anemia, and medications to help with the bone mineralization. A dietitian also works closely with the patients to help with their diet options. Our nephrologist at South Texas Renal Care Group will see you once a week during your hemodialysis treatment, and will review your treatment plan, your blood pressure, and all your medications. Our nephrologists are passionate about the care of their patients, and we take time to listen to all your concerns. We understand how important it is for each patient to have an excellent relation with their nephrologist, and we are passionate about the care that we give it to our patients.